Maas and team and a very kind patient who's agreed to help us with skincare education today. And I think this is one of the things where the average woman has 7 products on her countertop, and they pick the day they're going to use it, the toner, for reasons that are obscure and not any particular reason. So what we want to make sure everybody in our team is doing is helping our patients get them an economical and effective skincare program that is something that becomes part of their daily routine, just like brushing their teeth. A lot of patients, some look naturally very young, like my patient here, and some are not so naturally young because of sun damage. But everybody, starting from teenage years and on, should be doing skincare, and even in youth, in childhood, should be using sunscreen, which is a critical part of the skincare program. But really, skincare breaks down to only a few molecules that actually work. There's a whole system out there of marketing and packaging, and the whole skincare industry, which is a billion-dollar industry, spends 90% of its resources on marketing and packaging, not on science. So what we go with is the science, not the latest melon seed extract or seaweed cream or whatever the nuances are, which are basically good moisturizers. And there's nothing wrong with good moisturizers. But the fact is that Aveeno, Lubriderm, and a lot of these moisturizers you can buy at Rite Aid or Walgreens or Eckerd's are identical in their moisturizing ingredients to the ingredients that are sold at Neiman Marcus and other places, and Nordstrom's and the expensive department stores, with some additive in it that has no science behind it. So without being disparaging to any particular of those, I'll just say that the key molecules that we know work on the skin are very few, and they include retinoids, in particular tretinoin, which work was done at the University of Michigan starting in the 1980s. And the first brand name that came out of that was Retin-A, and everybody sort of heard of Retin-A. There's a handful of other molecules that there's growing evidence and data on, but they're really still growing. They're not really there where we can say with unequivocal certainty that they're going to provide a tremendous benefit. And so spending a lot of money on molecules that don't surely provide a tremendous benefit makes no sense. In our program, we break it down into really 3 different products. We have the Lift product, which you can get one of those for me if you wouldn't mind. That is the Retin-A containing, tretinoin containing molecule, and not in high concentrations. It's a little sun sensitizing, and so you can't be putting it on and going out in the sun. But you can use it on your face, hands, and chest, all the sun-exposed areas that we were talking about before. You have a little bit of hyperpigmentation. This can be post-inflammatory, after inflammation hyperpigmentation. We call that PIH. We have some dyschromias on our hands, the little sunspots, and they're called senile lentigines. Bad name, I didn't make it up, but that's the name for big spots. They're basically big freckles. And in the end, the system is very simple, where it's broken down into what I call cleansing and exfoliating. And everybody at home should know that Cleopatra, starting in whatever that was, 5000 BC, was doing gentle exfoliation with light acid washes. You can use a little 15-cent buff puff to do that, a little bit of a light acid wash, or a non-detergent cleanser like Purity, the one that we have here, any of those, and they're not expensive. The whole reason that I want to have people on this is that you don't have to spend a lot of money to be on really good skincare. So the skincare, I mentioned the molecule tretinoin. It starts, though, with cleansing and exfoliating. You can do peels here in the office. You can do gentle exfoliation with a buff puff at home. There's a couple of different cleansers that we use. The Medi Wash is one of them that has a little beta hydroxy acid in it. The Purity, which is another one that's if you have sensitive skin, that's a little easier. And then in treating the skin, I'll just lay these out for you. We have the Lift product. The Lift product is, the main ingredient is tretinoin, and you use it daily and you use it at night. Now, I put a few other things in there with this in the compounding pharmacy that makes it for us. It's got DMAE, which some people take as a supplement. It's an antioxidant. It's got a little bit of adiponone, which is known as sold as Provage MD at some of the high-end department stores for $300 a bottle or something. But Again, it's a molecule that's an antioxidant. It may help. We're going to go with, that it does help a little bit, but you don't have to pay a fortune for something that we're going to say may help as an antioxidant. So that's all going to be in the Lift product that's right here. So this little tube, you put a pea size, or like I said, a lima bee size amount in your hand, and that's a little dab here, here, and here, and on your neck, and that's enough to get your décolleté, neck, and full face, because it's got a nice emollient in it. This also has a little bit of estriol, which is an estrogen analog, but doesn't have any impact if you have breast cancer, so it's not systemically absorbed. And those ingredients with a little bit of glycolic acid, just gentle helps to break up the stratum corneum, the dead skin cell layers, are enough for the night. You wash your face gently, light buff puff. You don't have to be aggressive. Some people use a Clarisonic, but you don't have to do that. It's spend a lot of money on that. And then the use of the lift is applied evenly, as I suggested earlier. So that's what you use at night. In the morning when you get up, and I also put an alternative here. Some people are a little sensitive to tretinoin, and if you are, we have a retinol product called Alive that is, retinol is growing in its frequency of use, and it's a very good product, but it's one that I think can be used as an alternative if you have skin sensitivity. So that's really, you're not in that category, so start the Lift. And then the Boost is the other molecule that we know there's a tremendous amount of science between L-ascorbic acid, which is vitamin C basically, as an anti-inflammatory and antioxidant effect. And it's actually can feel a little tingly when you put it on, but interestingly, it has some sun protective, it's not sunscreen, but it has some sun protective effects, and its anti-inflammatory antioxidant effects are very powerful. So, there's one thing in the morning and one thing at night after you gently cleanse your skin, and then you use one of the sunscreens. The face shield is the most potent. They should have a physical blocking agent, zinc or titanium oxide in it. This is in the face shield, and that's this product right here. But, a small amount, and it's got a little bit of a matte finish, so you put it on before makeup, and you put it on after you've applied either the Boost or the Boost usually, because you're putting on the retinoid, the Lift at night. So, but sunscreen in any sun-exposed area, we can get you from. This is very powerful, and you can use it also on your body. We have a bigger tube for body applications. For you with hyperpigmentation or darkening of the skin, if there's any areas, whether it's from inflammation or just sort of age spots, there's the melanocytes, the skin pigment-producing cells, are making too much pigment. And what's interesting about them is once they've made too much pigment, the body sort of thinks that's the status quo, and it'll keep making the pigment to keep that level. So what the Restore does that I talked to you about earlier, and this also has the tretinoin in it, the molecule 1%, a little higher concentration, but it has hydroquinone, it has licorice extract, which is an anti-inflammatory and a depigmenting agent, and it has dexamethasone in it, which is a steroid that's not systemically absorbed. It's just working locally, because the first two, the tretinoin and the hydroquinone, can be a little inflammatory. So we want to calm the skin down with the dexamethasone and then use these molecules that down-regulate or calm down the melanocytes, the pigment-producing cells. So in this one, you just put it on the spots, really. You don't want to put it everywhere. You just want to put it on the spots. Mm-hmm. So you use it once a day, at least at starting, and you use it at night. So recommending, if you're using the Lift too, you put the Lift on first, and then just hit the spots with the Restore, just a small squirt. Mm-hmm. You can use them on the long-standing hyperpigmentation you have on your legs from basically that's PIH2, post-inflammatory hyperpigmentation. And then we're going to do an acute treatment for pigment, something that we can get immediate response over a couple weeks, is intense pulse light or photo rejuvenation. And I'll show that machine if you can bring it over a little closer there for me, Lena. So this one, and then we'll turn it on too, but this one, this particular device has multiple hand pieces, but I'm going to show you, you've had this before, I think, yeah. But the net of it is that the device has a crystal at the end of it, and so through this tube, very intense light is passed through this crystal, and I'm going to apply that to the skin surface through a little bit of a gel, and when the light hits the skin, it doesn't damage the skin because it's relatively clear, but the energy from the laser, or the light, it's a broadband light, but the energy from the broadband light is picked up by these pigments, and those pigments are damaged. You can just let it warm up. You don't have to do anything right now. And as it's picked up by those pigments, the damage to the pigment will naturally rise to the surface. It also will shrink the blood vessels too, so you get a dual benefit because we get dilated vessels through the skin. And so we use this a lot like, I use the analogy of mowing the lawn, because this footprint of this is, a couple centimeters square, or maybe about 5 centimeters square. And this isn't on right now, but when I do it, I'm going to pulse all the way around and do the entire, sort of cover your whole face so that we blend the areas, but we're going to target the darker areas. In fact, your face looks so good, we could probably just do the dark areas. On your arms, we have a lot of target, a lot of brown stuff. Well, that's an area where we'll treat the whole thing. And as I mentioned earlier, you have some seborrheic keratoses, the little brown growths that are like on the other arm, and that might be a subcare there. Those usually don't respond as well to IPL, and we'll have you come back and do a little light curettage where some people freeze them, some heat them. I usually use a little curette and just they're not deep in the skin, they're not moles, they're really just benign waxy growths of the skin that we'll treat. So pretty simple, and I'm going to do the first couple of pulses here, and then get our nurses to sort of take over and do the rest.
Okay.
Do you have any questions?
I don't think so.
Okay, well, we'll get going then, all right? And this is Dr. Maas. I'm looking your best. She has as much pigment as she has. You got to be conservative. You can't go too aggressive with it, and I'll show you what I mean in a second. And you notice that I picked IPL skin treatments, 1, 2, 3, and I picked hyperpigmentation, and then you're picking the depth of that. So, yeah, that's good. Well, it's not that important for this, but if you clear in a little bit of the gel away, but all these dark spots and red spots and brown spots are classic lentiginous. So we're going to treat those. And we wipe the cream off her arm first, because it should be nice and clear if you did that. So we don't want any opacity to the gel. The gel should be nice and clear. And now, if you want to, that's okay. I'm going to just show you this. I want to say 1, 2, 3, and give you a little pulse. Ready? 1, 2, 3. No, I know I did this because I know I'm conservative enough in these treatments to know that it's not going to cause a problem. But really, I teach you guys to do a few pulses and then stop and look. And what you should see is that each of these are getting a little darker. So there's a little bit of darkness in that, and when I do the second pass it with the 560 filter, you'll see even more. But we're going to continue up the arm, and then with the 560 filter, I'm going to feel that a little more. You feel a little bit more? You should see them get darker initially.
Yeah, the one that was kind of on the back on this arm.
And you can see the spots are now much darker than the surrounding skin. So that's a good result. That means we're picking up the pigment.
Comparing the arms. Sorry.
No, I'm comparing the skin to, you can turn it this way, it's okay. I'm comparing the skin here to the skin here. So you can see it's darker, right? You see that the contrast between the little pigmented lesions and the skin itself is much more dramatic. Okay, so let me have the tongue blade. And so we could probably bump it up a couple joules because you don't see a lot of erythema around these, right? See a little bit of darkening, but not much erythema. Yeah, I don't see much. But they are darker. That means it's working, right? That's the main indicator that you're getting a result.